Of course, I understand many of you are primary care providers, but I already mentioned that you can able to provide at least information and counseling about the gender transition and mental health issues. So whatever from the primary care provider point of view, from that scope, whatever you can address, I think that will be very helpful. You can also offer referral services if you once you have the list of the gender transition team which is available in your own city or in your state. So that will also be helpful. So I think the other things which I think the providers here can do is obviously because everybody is here because they are very interested in providing care to marginalized communities. So I understand that's the reason why they would also like to increase their knowledge and skills in providing care to LGBT people. But they can also then share this information and uh, information and impart skills to their colleagues in their own clinics and other hospital. They can also be a champions of LGBT health wherever possible. So it may be a lot to ask, but I'm just thinking like what else people can do. Yeah, and advocate for the LGBT friendly hospital policies like anti-discrimination policies. Yeah. Yeah, I think before I forget, I think one thing which I have seen some of the concerns among the primary care providers is if they start seeing LGBT people, especially transgender people, transgender women, then I have seen people discussing with me like whether they will lose their mainstream clients, mainstream patients, because other mainstream general population patients may not be willing to sit with say especially transgender women. So that may actually prevent some people from offering services for LGBT people. So I just wanted to also pin that issue here. Of course, the solution you have to find your solution, find the solution. So, but that's an issue which usually comes up. And some other doctors I have seen because they may be from a particular, say, uh, cultural background or religious background or moral background. Some people may not be comfortable in offering services to LGBT people. For such in such condition, of course, obviously we need to also address those reasons. What could be the reasons which actually prevent people from taking care of LGBT people, offering non-judgmental and non-discriminatory services. Yeah, I think the main reference I would suggest is the WPAT guidelines. So if you can go to this WPAT website, you can download the standards of care. So the same standards of care is also recommended by the Transgender Protections Act. So it is important. Maybe of course it's a relatively long document, but a shorter version is available as an article. So if you can see this first article, so that is a shortened version of the same. Maybe you can read this particular article, which is nothing but the WPAT guidelines, the Coleman et al. Article. So, so WPAT guidelines I suggest. So some of you, if you are interested in taking some online courses, you can go to the second website. I think some are free courses, but some obviously some are paid courses. The third website was formed by me in 2002-3. So it still has some of the training materials which I prepared at that time, which I have also updated. So if you go to the training section, you can download the training manuals and training of trainers manual, but that is restricted to men who have sex with men and transgender women, not to entire LGBT population. The fourth URL is actually expert committee report. I was part of that committee. So if you can look at that document, there is one chapter on health and a couple of other documents which are relevant for everyone, including which talks about the identities and stigma, discrimination, violence. So I also recommend that expert committee report. Okay, the fifth one is more like a summary of what are the health issues of the LGBT population too. That is a relatively easy read, so that can also be people can look at it. So that is about the website. So I have also listed some of the books and book chapters. Some of these may be available online. I think if you can Google it, you may find a free ebook of the first two. Again, in relation to the government, because the situation is changing, maybe you have to keep in touch with the local community agencies. They may be actually having a list of LGBT friendly doctors who can offer hormonal therapy and mental health care and gender affirmative surgery.